Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Kate Pierce. She's Senior vCISO and Executive Director of Government Affairs at Fortified Health Security and a former CIO and CISO at a provider organization. Welcome, Kate.
Well, thank you, John. I really appreciate you inviting me to speak with you today.
You know, we've searched high and far for a female CISO, and you're the first we found. I think there's a few others out there we haven't been able to get on the show, but no, so I appreciate you coming on to talk with us. But for those that don't know you, tell us a little bit about yourself and Fortified Health Security.
Sure thing. I was the CIO and CISO at a health system for about 21 years. Recently, about 2 years ago, made a move across the country and took a position with Fortified Health Security. Fortified Health does manage security services. So we are an MSSP, and we provide CISO services as well as a whole array of threat defense center and advisory services for healthcare organizations. We're pretty unique because we are healthcare only, and so they really enjoyed Fortified as a customer, and now I'm enjoying being on the other side so I can help more healthcare organizations than just one.
Yeah, I think that's awesome. We see that a lot with leaders that they're like, I can impact more if I work for a vendor. And, you know, it's such an interesting transition. But I want to talk about another transition. You know, it's kind of on top of all of our minds, I think, these days. And that's the change in the political administration. And maybe, you know, talk about, you know, that as a framework. What does that mean for healthcare? How is that going to impact us? And I think we'll take it from a number of different perspectives. But the first one I want to dive into is, how do you think this will put pressure on healthcare organizations to improve their cybersecurity posture, or will it not, right? Will this administration not really change that?
Well, I think, we've been working with the administration, the Biden administration, for a number of years now to advance cybersecurity in healthcare. But it's every instance that I've been involved in has been a very bipartisan issue. We see support for improving healthcare cyber on both sides of the aisle. So I'm hoping that the changeover administration has a minimal effect on some of the progress we've made to that end, and that they continue forward on a path that is going to be advantageous for everyone in healthcare, hopefully.
Yeah, I mean, it feels like cybersecurity is a bipartisan issue. In fact, it's an issue for every single, not just healthcare organization, but every organization. So it's hard to imagine they would change. Maybe some collateral damage from something they do, but I mean, you look at a lot of the initiatives from NIST. The different, was it 40/50 frameworks? All of those seem like bipartisan. Is that what you see in your conversations as well?
Yes, it is. Like just last week, Senator Cassidy, who is the ranking member of the Health Committee currently, introduced a new bill for a new piece of legislation for healthcare cyber. It's called the Healthcare Cybersecurity and Resiliency Act of 2024. And there were 4 senators that sponsored that bill, and there were 2 Republicans and 2 Democrats. So I think we're continuing to see that be bipartisan across the board as we go, as we move toward advancing cyber in healthcare. Currently, we're in the process of working. So I work with a group called the Health Sector Coordinating Council Cybersecurity Working Group. And this group is a public-private partnership that's been in place since 2018 and has done a lot of great work with healthcare delivery organizations and a number of other healthcare organizations, as well as with the federal government, like the FDA and HHS, et cetera. So we've been HHS has been working with this group to develop some potential updates to the HIPAA security rule, which was part of a 4-part strategy that they introduced last December. So that was delivered to the White House in October with a plan to release that for a notice of proposed rulemaking in December. So I think we're going to see that come out fairly shortly. It's proposed to have a 60-day comment period and then go to remediating the comments or addressing the comments before it goes into law. So hopefully we'll see that continue to go down the same path that it's been intended to go down currently.
Yeah, I'd be surprised if it doesn't. In fact, I think most of us have been waiting for that, update to HIPAA. HIPAA's a pretty old regulation. There was the omnibus package, of course, that came out that updated some things, but it certainly isn't taking into account how the speed of evolution, including things like AI. So it'll be interesting to see what comes out there. I think the bigger issue, though, you kind of, in your intro alluded to is the lack of skilled people to be able to service many in healthcare and the needs of healthcare security. And so when it comes to the kind of this skills gap in cybersecurity, how should a CIO or CISO be working to address the security need? And should they go in-house, or will they have no choice but to look outside and use an organization like Fortified?
Well, I will say you're spot on when you talk about a skills gap, and it's more than just a skills gap too. It's just a total lack of resources. So,
Mhm.
ISC Squared puts out a health cybersecurity skills report annually. It's a global report, but it breaks it out, and it looks like the United States, our skills gap grew by 4.4% last year. So this is despite the fact that we were making a conscious effort to grow more security workers in the United States. That gap continues to get higher, and there are currently over 500,000 open cybersecurity positions in the
What?
United States.
500,000?
Yeah, it's a 500,000 open positions in the
More
United
people
States.
should be studying cybersecurity if they want a job.
Yeah, the problem with that is a lot of these positions aren't entry level positions, right?
Mm.
They're looking for, mid-skilled to upper skill level positions, and it's hard to fill those. So folks that are looking for this are also seeing that even if they had cybersecurity personnel, those personnel in-house continue to have skills gaps in certain areas like cloud
Mm.
computing and AI have been the two biggest areas where we're seeing like they just don't have the skills in-house to meet those gaps. So how are we growing those internally as well? So there's a lot of programs currently out there. President Biden put out a cybersecurity workforce and education plan last year that is currently just getting off the ground and going. So we'll see that there's more universities, more professional education is being, addressed across the country. But in the meantime, how do we protect ourselves? So
Yeah, I
security.
mean, the CIOs I talk to that are taking two approaches, which you kind of highlighted. One is I got to grow my existing talent to be able to, educate them on and upskill them to be able to do the cybersecurity, or I've got to just pay a vendor to come in and do it, because cybersecurity is not an option, to avoid not doing it, and avoiding it's not an option. You have to do it. So yeah, I think that's interesting. It'll be interesting to see how that continues to evolve. I mean, you were CIO and CISO, which I think is interesting that you were both. I've seen a few of those through the years, but you know, every healthcare organization has a limited budget, limited resources, finite resources available to them. How do you think that's going to affect organizations' ability to meet the new healthcare regulations and even security requirements that we have going forward?
Well, I see that like health systems have very limited budgets almost across the board, even though you do see some larger healthcare organizations, much more able to protect their networks and have strong cyber teams. A lot of times what we'll see is these rural or community health organizations or smaller physicians' offices, et cetera, just have no ability to recruit and retain resources to address this, nor do they have the funding or the time to address these issues. So I think that has been taken into consideration. I know HHS proposed in their FY 2025 budget $1.3 billion to assist, and it would be a kind of a phased approach to addressing these cyber security performance goals that they announced in their December 2023 HHS strategy. So I think we're also seeing some states like New York State take state initiatives or propose or undergo a state initiative. So in October 2nd, exactly, New York State passed a piece of legislation that requires healthcare or hospitals within the state to achieve these very strict cybersecurity programs that they are addressing in that. But they bundled that with $650 million to help those organizations achieve those strong cyber programs. So, you know, if the federal government takes a little bit longer to address these needs, then I think we may see other states that like to be leaders in these things take the path that New York State has taken with those cyber goals.
Yeah. I mean, we see that a lot in healthcare. If the federal government doesn't do it, there's a lot of states that will just go and do it themselves,
Right.
which can be great and also challenging. It depends on how it's implemented, right?
Yeah, I mean, luckily in New York, they stated that this is in addition to HIPAA, not in replace of. So obviously, any federal regulations, every state has to meet, but states can impose stricter regulations within their states. So it'll be interesting to watch how the year unfolds, and we see these things come down the pike, or get
Yeah.
stalled in the
Will there be a
pipeline.
meaningful use for cybersecurity? That is the
Right?
question.
Well, I
Almost.
mean, if you look at the HHS proposed budget, they are proposing to use a very similar approach that they use with meaningful use, using the same reporting tools, et cetera.
Hmm.
So, um,
Yeah.
yeah.
We'll see. I've heard a lot of people, advocating for we need some extra budget for healthcare to be secure, and that's an important priority. So yeah, it'll be
Yeah,
fun to watch.
the bill that Senator Cassidy and his cohorts introduced last week included a section on providing grants to healthcare
Hmm.
organizations to achieve these cybersecurity updates. So I think that everyone has that in the back of mind. I'm actually on a task group with the Health Sector Coordinating Council for under-resourced or underserved for providers to, and we should be we just finished with all of the interviews, and so we should be putting together the results of those surveys and recommendations to HHS in early 2025.
So get your grant writing skills up to beat. It sounds like that's interesting. Well, I think we have to talk a little bit about AI. You can't have a IT discussion without a little AI discussion. So, do you think, will AI be an enabler for cybersecurity initiatives, or will it kind of widen the disparity for organizations like rural healthcare that you talked about?
So I think those are two distinct questions, John.
Okay.
So will
Yeah,
it
go
be an
for it.
enabler for cybersecurity? Definitely. We saw that in the cost of the data breach report that came out for 2023. And we saw the cost of the data breach in healthcare actually go down for the first time in, I don't know, 14 years, right? We are still double the cost of any industry at 9.8 million per breach, but we were at 10.8. So we've come down about $1 million per breach. I don't know if that'll hold in 2024, given the Change
Yeah, I
Healthcare breach coming in
was
at
gonna say
2.9 billion.
there's an outlier, but yeah.
So yes, it's an enabler for cyber defenses, but it's also an enabler for cyber attackers. So when you see it from both sides, we need to be very nimble and with the ability to address these attackers in all the new ways that they're constantly developing to attack healthcare. So we've seen an extreme sophistication now in those phishing attacks. Like there's no longer, oh, if you notice this wording doesn't sound quite right or whatever, it's all gone with AI. So they're
Yeah.
becoming much more sophisticated, much more difficult to identify what a phishing email scam looks like. The other thing they're being able to do is be very, very quick when we identify a vulnerability in an organization. So maybe it's it's a Microsoft, or it's a, a firewall, Palo Alto, whatever the vulnerability is, they're becoming very quick to use that vulnerability against us, right?
Mm,
Develop an attack vector. We're seeing tons of 0-day attacks now. So we're seeing more and more very urgent patch your system alerts that are going out every day. So it goes both ways. When it comes to, is it going to be an enabler? Yes, but it's an enabler for both sides. As far as the rural healthcare disparity, I think, personally, I think that is going to continue to widen that gap. And I'm saying that because rural healthcare organizations, first of all, getting into the AI market right now in healthcare is a complex thing. You need to build out some governance. You need to figure out where the AI is being used, whether you've authorized it or not. What are your rules? How do we control this internally to make sure that we're not putting ourselves at risk, et cetera? So, and the tools themselves are very expensive right now. So I think right now we're going to see those leaders come across, those larger organizations that are going to lead the way and build the path until it becomes more common. And just like with all technology
I
becomes
was
more
gonna say
common.
all of it's followed that path to
Right,
some degree.
right. I mean, I don't think healthcare rural organizations are going to be the leaders here. They're going to wait for these larger organizations to figure out where's the best bang for your buck, and then work from there. So in the meantime, I think our disparity is going to continue to grow for those
Yeah.
rurals.
I mean, the scary thing is you know what you said about the risks for these organizations, the 0-day vulnerabilities. That's true for every organization. And, like it doesn't matter which company you are. When we had the big issue, the breach, the Change Healthcare, CrowdStrike, whoever it was, right? Every other vendor was like, hey, I'm not saying much because that could be me next week, right? Like, and so I think that's the scary part, is it really could be anyone. And to your point, they're becoming much more sophisticated in how they do it, and the quality of the attacks, and that's what makes it so hard. Uh, yeah, and rural healthcare is just trying to survive in many cases,
Sure.
let alone
That's definitely
yeah.
true. So, I mean, we did see last year, and I think it was in the middle of the summer sometime, that um, the HHS announced a collaborative with Microsoft and Google to assist those smaller organizations in building their cyber programs and offsetting some of the costs for Microsoft tools, et cetera. So, but that was somewhat limited in who could access that funding and how it was being deployed. And I think that's from the Microsoft, and I think Google is still working on how they're going to address this on their end. So I think potentially those programs will grow. It'll just depend on how HHS decides to move forward with that initiative. So.
Yeah, absolutely. Well, we always like to wrap up these podcast episodes with a little career discussion, career advice. I'd love to hear, what advice would you to give to someone who's maybe just starting their work in healthcare IT and cybersecurity?
Well, I would say, like, there are a lot of different avenues you can take in cybersecurity. I mean, you could be a pen tester, you could be a security engineer, you could work on developing software. So there's a many different paths that you can take in cyber. So I would say the first thing that you need to do is build a firm foundation of understanding how healthcare IT works, because you can't protect something that you don't understand, right?
Mm,
So I would encourage them to, get an internship, do a mentorship with somebody, get your feet on the ground, boots on the ground, because when you're coming out of school, those things are great for your knowledge and understanding your skill. But until you have boots on the ground and understand what it's like to try to get to the balance of everything I need to do to secure my network versus what are healthcare organizations need to provide patient care. And you can come to that balance that ensures that the healthcare organization you're working for is ensuring the best, safe, secure, quality patient care. Then that's where I think you need to make sure that you're starting from that scope and not just from, hey, I have this long list of certificates. It's about what you understand about healthcare IT in general.
Yeah, we are a little insular, right?
Yes.
We feel like we're a unique little snowflake that, you better understand healthcare, which is probably part of our skill gap problem as well that we talked about
Could
earlier.
be. Could be. I know as a CIO and CISO, I was constantly fighting with myself because it was like, I know I need to protect this, but I know these guys need to use these systems. How can I get to the place where it's the least disruption to them, but the most protection for us? So,
Yeah, absolutely. Well, that's good advice. And, I think creating those connections, getting that understanding of the industry really is important. So, Kate, I appreciate you taking time to sit down with me and be part of the podcast and share your insights and perspectives. It's going to be a fascinating transition with this administration, but I think you're right. I think it is a pretty bipartisan, and securities in healthcare is going to be an important topic going forward. So thanks for helping to enlighten us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks, Kate.
thanks so much and happy holidays.